Hi, it's Dr. Wright here. I'm just going to wait a minute or two before I go live. Okay, I see here some people are signing in. I'll just give it another few seconds here. Thank you for joining. I see some people signing in here. And so let's get started. My name is Dr. Lakia Wright, and I am a board-certified allergist and immunologist. I am also medical director of U.S. Clinical Affairs at Thermo Fisher Scientific in the Immunodiagnostics Division. And I want to welcome you to Right Now Allergy Updates with Dr. Wright. And I'm so happy that you joined today because we have a very exciting topic to talk about, a topic that sometimes causes a lot of confusion. Is the topic of wheat allergy versus celiac disease versus a gluten disorder, like a non-celiac gluten disorder. And this is in sort of the spirit of Celiac Awareness Month. And so I'm very excited that everyone has joined here. And what we'll do is we'll talk about sort of the, basics, what are the basic symptoms or signs and symptoms, and what is, how do people make that diagnosis? How do clinicians make the diagnosis? And then, like sort of what's the typical treatment. And so with that being said, I also want to remind the audience that this video is for educational purposes. And really, I encourage you to reach out to your healthcare provider so that you can get medical advice, based on your clinical history. So this video is not medical advice meant to be, this video is not meant for medical advice. But we do encourage you to talk to your healthcare provider. And then also the content in this video may help to facilitate that conversation. And if you have any questions, feel free to drop them in the chat and I'll get to them shortly. So let's dive in. And so the first thing that I want to talk about is sort of like the basics. Let's go over wheat allergy first. So when we're talking about wheat allergy, we're typically referring to it as like an IgE-mediated allergy to wheat. And so we know that wheat is among the top 9 common food allergens. So you get those classic IgE-mediated symptoms, whether it's skin, where you can have something like hives, respiratory involvement, like cough, shortness of breath, wheezing, throat involvement, like sensation of throat closing. Now you can get abdominal symptoms like, feeling abdominal pain. You can even get, GI upset, like, nausea, vomiting. So all those classic symptoms, and when you have IgE-mediated disease, we know you're at risk for potentially having, anaphylaxis as well. And so that's typically what we're referring to when we say, wheat allergy. But we know that wheat can manifest itself in other ways too, like eosinophilic esophagitis. But when we talk about wheat food allergy, typically we're talking about, IgE-mediated symptoms. But then, how does that differ from celiac disease? So celiac disease is different in the sense that it's actually autoimmune disease. And when you think about autoimmune disease, you're thinking about the body sort of attacking itself. And it's attacking itself in seeing sort of gluten. And we know that when we talk about gluten, it's commonly found in wheat, but then there are other grains like, barley and rye as well. And so with celiac being an autoimmune disease, your body is producing these antibodies when it sees that gluten-containing foods, and then as a result, there's damage in the small intestines, and you can have problems with absorption. And then, so common symptoms would be abdominal pain, bloating, you can have diarrhea or really foul smelling stool, and you could even have symptoms like anemia and even rash sometimes, but it's not like a hive-like rash, it's more like a lumpy, bumpy rash. And that leads me to talk about the next one, which is non-celiac gluten sensitivity. So it means that you don't meet the criteria for celiac disease, but you're still having, some symptoms when you eat foods that contain gluten. And those typically, you can have things like abdominal pain. You can even have things like, diarrhea, stomach upset, and bloating. So you can see why, this can be confusing, because these disorders can be triggered by gluten, and then gluten is commonly in wheat, and so it can be hard sometimes to figure out and tease apart. But the best thing is if you think that you have any of those symptoms, and you're not quite sure what disorder it is, it's important to really talk to your doctor, because based on your history, your doctor could give you the appropriate diagnosis. And in some instances, testing may be appropriate. When we're talking about IgE-mediated disease, of course, we have tests like blood tests and also skin tests that can evaluate for that, and they help to aid in that diagnosis. And then when we do testing for celiac disease, that's more looking at antibody testing, because again, it's autoimmune disease. And then when you have non-celiac gluten sensitivity, your doctor may need to do testing to sort of rule things out, depending on what the clinical scenario is. So it's really important to go to your doctor and have sort of like a list of all the things, all the symptoms that you've had, into which foods, and that would help guide the conversation and the discussion. So what I want to go to next is I want to go to a few questions that we got, and one of the question is, what is gluten? Gluten is a protein, and this protein is contained in foods, like pasta, noodles, it could even pasta and noodles, or even breads. Those are common ones. And then another question I have here is, well, how do I know which one I have, which I discussed. It's really important to talk to your healthcare provider and give a really, really detailed history. And then another question we have here is, if I have a wheat allergy, do I need to avoid all grains? And so that's a really important question to ask, and I really want to spend some time going over this. So we know that wheat is a common food allergen, among the top 9 common food allergens. And we think that, wheat, it's estimated that it's about, 0.4% of children have a wheat allergy. Now, when we talk about grains, wheat is a grain, but then there's cereal grains and non-cereal grains. So we have things like oat, barley, rye, even corn, rice, quinoa, things like that. And, these things can be related, but clinically we see that typically if you have a wheat allergy, you might have other food allergies, but it doesn't mean that you're going to be allergic to all the grains. So that's why it's so important to go see your doctor and to give a good clinical history. And then your doctor, based on your history and the results of your testing, would be able to come up with a diagnosis. But it doesn't mean that you're going to have to avoid all grains when it comes to IgE-mediated, food allergy. That's for your doctor to help decide and help to give you an official diagnosis. And so if you suspect a gluten disorder, like celiac or non-celiac gluten sensitivity, should you just take the gluten-related foods out of your diet? This is a common question that I get asked, sort of quite frequently. And the thing is, you want to talk to your doctor, because your doctor, might say, yes, depending on your symptoms, take it out of your doctor. But your doctor might say, you know what, I think that this is, I think that it's best that you minimize it in your diet and not completely take it out, and then let's do some testing, and then based on the testing results, that can help aid in the diagnosis, and then your doctor can make like a more definitive decision regarding your diet. So the most important thing is, before you start taking things out of your diet as it relates to gluten disorder, it's really important to talk to your doctor and to ask, is it appropriate for me to take it out of my diet? And again, because there's celiac disease, where, patients have to avoid gluten. But then there's also non-celiac gluten sensitivity, which is more like food intolerance. And then some of those symptoms could be, like related to the intake, like dose dependent. So if you eat a lot, then you have symptoms. If you have very, minimal amounts, then you may not have symptoms. But that's something to talk about with your doctor, so that the doctor can give you the appropriate dietary counseling. And so the other question I have here is, well, what's wheat-dependent exercise-induced anaphylaxis? And so this is actually something that is very, very rare, but you might see it when you're, turning to Dr. Google and looking up, different sort of wheat reactions or gluten reactions. But the wheat-dependent exercise-induced anaphylaxis is very rare. So it typically happens when someone can, tolerate wheat. But then if they eat wheat within a few hours of exercising, then they can have anaphylaxis. But again, it's very rare, and there is, in addition to clinical history, there's testing that can be performed to help aid in the diagnosis, and your doctor would be able to counsel you about that. And so the next thing I wanted to do, because I have been talking a lot about talking to your doctor, and so I just wanted to give some tips for talking to your doctor about these different food reactions. And so number one, you should keep a food diary. And then number two, in that food diary, it's really important to document all the different types of foods that you suspect you're reacting to, and then what are the symptoms. And so when you're documenting the types of foods, it's also good to take a snapshot of the ingredient list, so that way you can always come back to reference it or cross-reference it if you're having reactions to multiple foods. And then also, when you want to document the food, you want to completely document the symptoms that you're having. Is it abdominal pain? Is it abdominal cramping? Is it diarrhea? Is it a combination of those symptoms? And then what is the timing of the onset of symptoms in relationship to eating it? Is it happening within minutes or seconds or hours? That's all really, really important information. And then when it comes to the signs and symptoms that you're having, if there's any sort of, skin changes like swelling or rash, you definitely want to take a photo of that as well. And of course, and this goes without saying, but I'll say it, if it's an emergency, of course you want to, call 911 and seek immediate medical attention. And so I don't see any more questions in the chat box. So what I'll do is I'll close out now. And again, I want to say thank you for tuning in for such an important topic, especially given it's Celiac Disease Awareness Month. So, look out for the next hot topic. Share and give this video a like if you like the content. And for more information, click on the link with the video description, and it'll bring you to Allergy Insider, which has more educational resources. And, I mentioned briefly about, sort of foods and cross-reactivity with the grains. be on the lookout for more educational content about cross-reactivity. That's coming soon. And so I want to say stay safe. And until the next hot topic, I'll sign off and see you then. Bye-bye.